Few things in this world are more frustrating than nerve problems, which is why carpal tunnel syndrome can be so debilitating. Sure, there are more serious medical conditions out there like heart disease, but that doesn't mean people with carpal tunnel syndrome aren't suffering. And while there are many causes of carpal tunnel syndrome, one that should never be missed is hypothyroidism. Why? Because it's a treatable disease. If you are one of the 16 to 20% of hypothyroid patients who suffers from carpal tunnel syndrome, then this video is for you. It is possible to get relief from this condition, but getting there will most likely require that you look into treatments that aren't even on the radar of your doctor. We will get into the treatments in just a second, but for now, let's start with the basics. Carpal tunnel syndrome, which I will refer to as CTS from here on out, is the most common nerve entrapment syndrome in the body. The reason that CTS is the most common nerve entrapment syndrome has to do with anatomy. The median nerve, which is the nerve that provides both sensation and physical movement to the hand, runs through a narrow tunnel in the wrist, which is surrounded by bones and filled with ligaments. Since this tunnel is so tight and there's no room for expansion, it's easy for things to press against the median nerve. And when that happens, bam, you'll end up with carpal tunnel syndrome. Plenty of conditions can cause this problem, including just being overweight, but the one that we're going to focus on today is hypothyroidism. And I hate to say it, but in addition to dealing with problems like weight gain, fatigue, and hair loss, thyroid patients also have to contend with annoying conditions like CTS. This is for two reasons. Number one is the buildup of mucopolysaccharides in the tissues in the wrist. The hypothyroid state results in the buildup of compounds called mucopolysaccharides as hyaluronic acid and glycosaminoglycans in various tissues in the body. This promotes a big problem because these compounds happen to attract a lot of water. And by a lot, I mean a lot. Hyaluronic acid, for instance, can hold up to 1,000 times its weight in water. And guess what happens when these compounds get into places that they shouldn't be and start pulling in water with them? You end up with swelling and edema. This can happen anywhere, by the way, including the ligaments and tissues of the wrist. But because there's not a lot of space in the tunnel of your wrist, and because the bones don't allow for any expansion if there is any pressure there, any little bit of extra swelling will cause damage and pressure put on the median nerve. The result? CTS symptoms like numbness and tingling. But that's not the only way that hypothyroidism leads to carpal tunnel syndrome. Number two is from obesity and weight gain. Just being overweight has been shown to be an independent risk factor for developing CTS. The reason for this is not well understood, but probably has to do with the fact that the obesity state is just an inflammatory state in general. The exact cause doesn't really matter for purposes of this video, you just need to know that obesity is associated with an increased risk. And because hypothyroidism very often leads to weight gain, in fact, it's the symptom that most patients with hypothyroidism deal with the most. This is yet another reason why hypothyroid patients develop CTS. This may seem depressing, but there's a silver lining. Both hypothyroidism and obesity are treatable diseases. The only thing standing between you and a life free of numbness and tingling in your hands is the right knowledge. If you are like most people with CTS, then you will probably start first by going to your doctor to get some recommendations. And if you go that route, here's what they'll probably tell you. First, start with non-steroidal anti-inflammatory drugs like ibuprofen to see if that reduces inflammation and helps reduce your symptoms. If that doesn't work, then you can try wearing a wrist splint or a wrist brace when you sleep. And if that doesn't work, then you can try steroidal injections directly into the wrist to try and further reduce inflammation. And finally, if none of those options work, then your last resort will probably be surgery. For the most part, this is the extent of the treatment options that your doctor will likely recommend. And if you are paying attention, then you should know something big is missing here. The thyroid factor. The treatments listed above may all potentially help the nerve entrapment component, but they do nothing to fix the underlying cause of the problem. And to top it all off, many of these treatments do not have a very good success rate. That's the bad news. The good news is that there are plenty of other things that you can try or use which will provide you with some relief. Sometimes as quickly in just a few hours or a few days. So before you fret about surgery or injections, take a look at these treatments first. Number one, start by optimizing your thyroid. The reason you need to focus on your thyroid is simple. If your thyroid is responsible for causing your condition, it will not go away until you treat your thyroid. What's that? You think that you're already taking thyroid medication, so this doesn't apply to you? Think again. There are a ton of thyroid patients out there right now who are probably listening to this who are being undertreated. Even having so-called normal thyroid lab tests doesn't guarantee that your thyroid is actually normal. And this is especially true if you have thyroid-related symptoms that still persist even after taking your medication. For hard-to-treat thyroid-related conditions, it's often necessary to change up your thyroid medication or add more powerful thyroid hormones to whatever you're currently taking. If you are somebody who is currently taking levothyroxine and not seeing any improvement in your thyroid symptoms, then that's a good sign you probably fit into this camp. T4-only thyroid medications like levothyroxine can work for some people, but it's not often the case that taking a T4-only thyroid medication will allow for enough T3 to reach all of your tissues. And this problem can be solved by simply adding T3 to your existing T4 regimen. You can do this by adding T3 in the form of cytomel or liothyronine, or switching to a combination T4 plus T3 thyroid medication like Adthyza, Armour Thyroid, or NP Thyroid. Additionally, you may find benefit by changing the route that you take your thyroid medication. For instance, taking your thyroid medication sublingually may help improve its absorption and reduce your symptoms. And if you're interested in learning how to take thyroid medication sublingually, I have another video that you probably want to check out. No matter what, do not skip this step. And make sure when you are evaluating your thyroid function using lab tests that you look at more than just the TSH. Number 2, improve flexibility, posture, and mobility. Even though your thyroid may be the root cause of your problem, doesn't mean that other tissues aren't playing a role as well. It's very often the case that thyroid patients, by virtue of symptoms related to thyroid dysfunction like fatigue, are not as active as they should be. Other symptoms like muscle aches and pains, again caused by thyroid dysfunction, can further limit their ability to move and exercise regularly. And guess what happens if you don't exercise or move? Your body, joints, ligaments, and tendons all become less compliant. They are more stiff and you are less flexible, which means there's less blood flow moving to all the tissues that need it. This is a problem because it means less thyroid hormone will ultimately make it to your wrist, which is necessary to eliminate the mucopolysaccharides that have built up there because they weren't getting enough thyroid hormone to begin with. This problem can be solved by utilizing the right forms of activity. Pretty much any type of exercise will be sufficient in pumping blood throughout your body, but some will be better for improving blood flow specifically to your wrist. If carpal tunnel syndrome is an issue, then yoga and Pilates are ideal. These forms of movement will help improve the function of your entire upper body, including your shoulder girdle and neck, which is where the median nerve originates. You'll also get the added benefit of more mobility to the nerve directly through nerve flossing, which is typically incorporated into these types of exercises. Exercising regularly will also provide direct benefits to your thyroid gland and help you lose more weight in the process. Number 3, make sure to open up the tissues where impingement can occur. When you look at the anatomy of the median nerve, you'll find something very interesting. Your wrist is not the only place that this nerve can be entrapped. The median nerve originates in the spinal cord and makes a very long journey through your neck, to your shoulder, and between the bones of the elbow before it finally makes its way to your wrist. And yes, many people do have impingement in the area of the wrist, but there are plenty of other people who have impingement on other places along that route. This is explained by the idea of double crush syndrome. This syndrome suggests that at least in some patients, those who experience median nerve entrapment also have entrapment in one other location as well. And it isn't until the nerve gets entrapped in 2 locations that you then start to become symptomatic. In other words, you may think your problem is in your wrist, but the problem could be in your neck, shoulder, or even your elbow. What do you do about this? Fortunately, you can improve the mobility of your head, neck, and arm with relative ease. Treatments like massage therapy, myofascial release, trigger point injections, and treatments with physical devices such as massage guns can all help. Number 4, prevent repetitive stress injuries and look at your ergonomics. Next, you want to make sure that you look at your daily activities. It may be the case that your thyroid is the principal cause of your CTS, but it's also very possible that you aren't doing your body any favors with certain inflammatory and repetitive motions. Constant use and misuse of your hands, for instance, result in a condition called repetitive stress injury, or RSI for short. Examples of RSI include things like tennis elbow, BlackBerry thumb, iPod finger, Rubik's wrist, and stylus finger. In each of these conditions, you are putting your body through repetitive motions, doing some sort of activity that results in inflammation and pain in whatever joint is being used. What you may not realize is that this very condition can occur in your hands and wrist as well. And one of the most common reasons for this is the constant use of computers. Putting your hands in a position to use your mouse and keyboard may be necessary for your job, but it's not great for the function of your hands. It's been known since the 1990s that computer users experience higher rates of disability and injury, and this problem has only gotten worse and more frequent over the last couple decades. The treatment for any type of RSI is to stop the offending motion and allow your body to heal. But this is easier said than done, especially for people who have to use computers for their livelihood. That's why the second part of number 4 is an evaluation of your ergonomics. While you may not be able to completely eliminate the need to use a computer every day, you can ensure that your body is in the best possible ergonomic condition to reduce the negative impact that repetitive motions have on your nerves, tendons, and ligaments. If you need to use a computer every day, then try these tips. Practice good posture when sitting at a computer. It's okay to move around, but you shouldn't be slouching forward. Use an ergonomic friendly mouse. Use a sit-stand desk. Elevate your monitor so that it's at eye level. Get a pad for your mouse and keyboard so that your wrist has cushioning. Invest in a nice chair. Make sure that your elbows are supported by either the arms of your chair or by your desk. Take frequent breaks and don't be afraid to move positions. Avoid staying in the same position for hours on end. If you are somebody who uses a computer for your day job, then it's worth spending some time, effort, and energy finding the best ergonomics for you. While carpal tunnel syndrome is a debilitating condition, there are many other symptoms that hypothyroidism can cause. And if you want to see a list of those symptoms, I'd recommend checking out this video next.